When COVID-19 hit Connecticut, one of the doctors leading the state's response wasn't a political figure or TV personality. It was Dr. David Banach, a physician who has spent his entire career studying how infections spread and how to stop them. He's not flashy, but his work is essential. And his story is one worth knowing. David Banach was born and raised in Connecticut. He liked science from a young age but didn't set out to become a public health expert. In his undergraduate studies, he followed his enthusiasm for science, where he earned a degree in business administration and biology. It was a mix of science and strategy, a combo that would later define his career. Banach returned to Connecticut for medical school and a master's degree in public health. He trained in internal medicine and infectious diseases, and he also completed a master's degree in clinical and translational research. After completing his residency and fellowship training, Banach returned to Connecticut in 2016 to serve in a dual capacity as a clinician and hospital epidemiologist. His job? Track infections, study outbreaks, make sure the hospital is safe for patients and staff. At the same time, he began teaching as a lecturer in epidemiology. He co-directs a course on healthcare epidemiology. When the pandemic began, Banach was called to serve on the governor's scientific advisory group. He became a go-to voice on COVID-19 for both the state and the media. He talked to newspapers, radio stations, and local TV outlets. Not for fame, but because people needed clear information. Banach was also quoted in multiple regional and national media outlets. He spoke about vaccine updates, mask guidance, and what rising flu cases meant for hospitals. Dr. Banach has published over 60 peer-reviewed journal articles. He's written about antibiotic resistance, infection rates in hospitals, and how to evaluate penicillin allergies. In one recent study, he explored Paxlovid use in Connecticut's most vulnerable communities. In another, he helped write a series of pandemic preparedness statements for the Society for Healthcare Epidemiology of America, SHEA. Banach is a past president of the Connecticut Infectious Diseases Society. He also works with the state's Department of Public Health. Students and residents often name Banach as one of their favorite instructors. He's won multiple teaching awards, including the First Year Teaching Award and the Fellowship Teaching Award. He says he learns just as much from teaching as he gives. Outside of academia, Banach volunteers as a physician preceptor at the South Park and Homeless Shelter in Hartford. Banach doesn't see infection control as something that ever stops. He believes future challenges will include climate-related disease shifts, antibiotic resistance, and improving healthcare access. But he's hopeful. Dr. David Banach isn't a celebrity doctor. He's a quiet leader, a scientist, and a teacher. He shows up, does the work, and makes the system better for everyone.